Healthcare Industry Lead for Apps Associates. Welcome to our second video related to supply chain in healthcare. In today's episode, we'll be talking about the integration of data flow between the Oracle supply chain system and the clinical side of healthcare with an organization's electronic health records. Joining me today is Chris Wise. Chris is an Apps Associates Delivery Manager in Healthcare Solutions.
Hello, everybody. Glad to be back with Kevin here. Look forward to sharing some of our implementation experience in healthcare, and today specifically about sharing information between ERP systems, SCM systems, and EHR.
Thanks, Chris. So to set the scenario, we have Oracle supply chain containing the item master, supply orders taking place, but usage occurring over on the clinical side, tracking the EHR. Chris, can you walk us through a real-world example?
Absolutely. Imagine a nurse documenting a procedure, giving care to patients in the EHR, and noting that 2 surgical kits were used. That usage data, or we refer to it a lot as consumption, can be passed real time to Oracle SCM, which then in turn adjusts the inventory flags, low stock, may even automate a purchase order, all without touching the system, no manual intervention.
So information related to the item details, such as quantity, cost, consumption, is continually passed back and forth so that both systems are accurate at all times. So what methods are used to handle the synchronization of this data between the Oracle system and the EHR, or does it vary based on what EHR a company is using?
Sure, Kevin, it's going to vary a little bit depending on the EHR. Some integration or some EHRs have built-in integration like Oracle's EHR, which is formerly Cerner. For others like Epic, Oracle just released a standard integration with Epic. We have a partnership there recently. And then for others, we apps have built standard integrations using some of Oracle's standard tools like Oracle Integration Cloud, which we'll call OIC later in the discussion, and Oracle REST APIs, and we combine that with healthcare data standards like HL7. So we're data compliant in the healthcare industry.
So another scenario is we know that the billing for clinical care occurs on the clinical side in the EHR, the oral billing system, but oftentimes a refund is needed to be issued to a patient. So how's that handled?
Good question. Refunds arise when a patient's overcharged or when services or supplies are canceled or returned. Typically, the EHR triggers a refund request. And then via integration tools like OIC, that request is formatted appropriately into an Oracle standard format, which then flows directly into Oracle financials, specifically accounts payable, and a direct payment to the patient.
So the patient refund is handled in Oracle's ERP. And since Oracle is integrated between finance and accounting, the necessary information is already available for the appropriate actions in accounts payable and general ledger, correct?
Exactly. Using standard Oracle integrations along with our apps developed library of extracts from different EHRs through experience, we're able to provide a complete business process for patient refunds.
So we covered the inventory and items staying in sync, the patient refunds. Are there any other areas that we integrate with or share information between the supply chain and the EHR?
Sure, one that's standard, not always, depending on the setup of the billing and revenue system with the particular hospital. But then we have the journal entry, or often billing and revenue activity is captured in the EHR and via standard journal entry integration using the tools that we had already mentioned, OIC, standard Oracle layouts, and the apps built library of extracts. We're able to build that journal entry flow.
So one more area. So what about user flow? So for example, if I've got a user on the supply chain side, how does that information flow from the Oracle supply chain over to the EHR system, like a user?
Right. It's not exactly supply chain or even ERP, but often the the HCM component of Oracle's ERP is sometimes used as the source for employee information. So while we can do that, it's not always an integration that's used, but often it is the source of using the Oracle HCM component.
All right, got it. So it's safe to say that after an App Associates implementation of Oracle ERP and supply chain, we intend on having a very solid integration between the Oracle system and an EHR system. Chris, once again, thank you for coming on and sharing your insights and knowledge with us.
Thanks, Kevin. It's good to join you today.
Thanks again for joining us today, and thank you to our viewers for watching. Be sure to follow Chris and myself on LinkedIn for more healthcare insights, and follow Apps Associates on YouTube.